Welcome to Sunshine Cathedral's Queer God Squad. It's Friday, March 20th, 2026. I am Bishop Darrell Watkins, the Senior Minister of the Sunshine Cathedral. With me today are the Reverend Dr. Ann Atwell and the Reverend Kevin Tisdall. We are the Queer God Squad. Visit sunshinecathedral.org to learn more about us.
Queer God Squad was created by Hotspots Happening Out to support our mission to explore the value of faith in the LGBTQ community. There is no streaming TV show like this in the entire world.
In 2026, we are celebrating the 41st anniversary of Hotspots Magazine, with Queer News Tonight sharing over 11,000 stories and 11 million views so far. We are the largest nonprofit LGBTQ media organization in America, and we encourage you to support our mission to inform, entertain, and educate our community and allies.
We are proud to announce that Hotspots Happening Out is a beneficiary of the Florida AIDS Walk. Funds raised will be matched dollar for dollar in support of Hotspots Happening Out's HIV policy reform and educational programs, including the MSM conference. We invite you to join the walk by making your signing up at www.faw.lgbt. Join us on March 21st to walk in support of the community impacted by HIV.
This is the Sunshine Cathedral perspective. Women often get overlooked when it comes to HIV. LGBTQ Nation reported in February the often overlooked impact of HIV on women in the United States, who account for nearly 20% of new diagnoses and over 230,000 current cases. Despite these numbers, women, particularly Black and Latina women who are disproportionately affected, face significant barriers to care, including medical bias, lack of research representation, and socioeconomic hurdles. A primary focus of the piece is the underutilization of pre-exposure prophylaxis, PrEP. While highly effective, PrEP is frequently marketed toward men who have sex with men, leaving many women unaware of its benefits or facing doctors who fail to screen them for risk. Furthermore, the article notes that women often prioritize the health of their families over their own, delaying diagnosis and treatment. The narrative emphasizes that ending the epidemic requires a gender-specific approach. This includes expanding access to telehealth, integrating HIV screening into routine gynecological care, and addressing the intersectional stigmas related to race and gender. By shifting the conversation to include women's unique biological and social needs, advocates hope to close the equity gap in HIV prevention and ensure that hundreds of thousands of women are no longer left behind in the national strategy to end the virus. You know, this doesn't surprise me, because women's health care has often been minimized or diminished. I can't tell you how many times I've talked to my doctor about something and they're, oh, no, that has nothing to do with you. But I think it's really, really important that all doctors, but I'm also going to say particularly female doctors, because a lot of women, not every woman, of course, but a lot of women like to go to female doctors. But I think that they need to have access to this info. They need to be more aware of PrEP and, possibly encourage their patients, female patients, to be tested for HIV and to have access to PrEP if they need it.
Yeah. I think that HIV being stigmatized as a gay disease, as a gay man's disease, was a disservice, because viruses, they don't have prejudice.
No.
They go anywhere they get a chance, So it's a disservice to think of it that way. And it's also the medicines have been so effective and so miraculous. I think sometimes we think it's been cured. It has not.
Wow.
And untreated is very spreadable. I mean, and then untreated is still deadly. And so it's important that we that remember this is not just a man's thing. It's not just a queer thing, and it's not over.
Yeah.
And so and also, it just occurred to me that this is the sort of thing that might be found more frequently, say, at Planned Parenthood, that is being all but eliminated. So people dedicated to women's health, especially nonprofit, are probably really up on these things, especially underserved communities. But we try to choke the life out of them, because a tiny bit of women's health care might include terminating a pregnancy, which which by the way is healthcare. It's fine.
Yes, it is.
Like, so like no even excuse about that. Like, you should be able to get an abortion if you need an abortion. But that because of that, you can also now, people aren't getting screened for breast cancer, they're not getting screened for vaginal cancer, they're not getting screened for HIV, they're not getting screened for HPV, because these women specific are being targeted
Yep.
for funding cuts and that sort of thing, as are a lot of social services these days.
Yep.
But yeah, I mean, if we really valued women and women's health, or all of our communities, we wouldn't try to starve out the few things that are trying to help them.
Yeah. Yep.
When you started talking, Reverend Dr. Ann, I went down a rabbit hole
Yeah.
talking about how women are treated by their doctors. Real personal story. My mother had a woman doctor, a female doctor. She went to the doctor on Friday for a regular checkup. 100% everything was A-OK. She died of a massive heart attack that following Tuesday. Why? Because the medical community does not often look at women and say that they have different issues than men. That women are biologically, physiologically different than men.
Yep.
And what is true for me may not be true for
Right.
Reverend Dr. Ann.
Right.
And the doctors don't understand that. Now you have PrEP, which is good for everybody.
Yeah.
Everybody. And women are being maybe not denied PrEP, but are not even thought about when PrEP is discussed. So what I see is a need to open up the minds of the medical community so that they fully understand that, yeah, women get AIDS.
But you know what? PrEP, PEP, IUDs, condoms, abortions. What is the thing when your tubes? There's a medical name for the
Tubal ligation.
tubal ligation. All of these things, in the minds of super conservative, sex negative body, are permission giving. They're like,
Oh,
oh,
gosh.
if you
Oh,
can,
they're going to run out there and have sex.
if you can be, if there's no consequence, you're just going to have a good time all the time, as if that were problematic. But they would rather put you at risk for your health than to not be able to police you in the bedroom, which doesn't work anyway. People are doing what they go. They're just now afraid about it, ashamed about it, and having consequences that could have been avoided if you weren't so miserable about your own sexuality or body or whatever. So yeah, all of these things that can keep you safe, in their minds, are also allowing you to be naughty.
Right, and that trickles down to women's health care.
Wow.
And that's today with the Queer God Squad.
Thank you for joining the Queer God Squad today. We are here daily at 3 p.m. to have some fun and discuss what our LGBTQ community is talking about. Please like and share this and other episodes of the Queer God Squad.
Sunshine Cathedral is the world's leading progressive queer church. Progressive, queer, and God are words that naturally should go together. Remember that we are all in this together. Also remember, you are God's miracle, not God's mistake. Until next time, we are the Queer God Squad.